So stage 2 of our 5-step process when we're looking at how to get patients out of pain is management of inflammation. And this really is probably one of the most important things, and particularly important for the patient. And the reason for that is, in a very real sense, it's the inflammation in the joint or the muscle or the ligament or the tendon. So it's the inflammation that's actually making you have pain. So although it's a difficult concept to understand, the actual injury is not the thing that generally causes the pain. It's actually the inflammation or the release of chemicals from that damaged tissue structure that actually causes pain. And chronic inflammation is something that's needing to be tackled both locally in the joint and actually locally in perhaps the spinal cord, because it's this propagation, this continuation of the pain message that actually is the thing that's causing you pain. And so as an example of that, if I sprain my wrist, what will happen is immediately we'll get release of neurotransmitters called prostaglandins, which then act like a text message that send information up to my brain to say, listen, we've got a problem, we think that we've got some tissue damage here, what you need to do now is give us pain in order that I realize I've got a problem and protect the area. And the problem is that no matter how hard we try, if we don't control the inflammation in the joint, then the brain is going to continue to give us pain. And in the clinic, we've adopted, I should say, a couple of different methods in order to try to reduce the amount of inflammation in the joint. And the key weapon that we have in our fight against inflammation might surprise you. It's actually the use of lasers, in fact red light therapy, and we will drop a link to our red light therapy video so you can go a little bit more into that in order to control the inflammation, because if we can control the inflammation, you experience an awful lot less pain.